Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about an exercise you can do referred to as isometric contractions for the shoulder, which is a strengthening exercise. But before I begin, please hit the subscribe button below so you can be informed about any new videos I provide on my channel here. So going back to an isometric contraction, so essentially what an isometric contraction is, it's when we're contracting a muscle without any movement. And this can be really important when we're working, for example, on somebody who's perhaps got some restrictions in certain areas. A lot of times with a shoulder, somebody who perhaps has an impingement where there's specific angles that are painful, isometric contractions can be a great way to start to strengthen a muscle without going into positions which are painful. So typically with an isometric contraction, I'm going to have somebody start with their arm just at their side, elbow bent at 90, and you can actually push against a wall when you're doing this exercise. So the four positions you'll want to work on here is referred to as shoulder flexion, where you're going to be pushing forward this way, shoulder abduction, where you're going out to the side, internal rotation, which is this way, and then external rotation. So if we're using the wall here, for example, I'll use this one right here. When I'm doing my shoulder flexion, right, I'm going to squeeze my shoulder blades back. I'm pushing forward, right? I'm going to use this side to show the other exercises. For shoulder abduction, which is this movement here, right, I'm going to again squeeze back. I'm going to push to the side, right, this way. And then for my rotation, what you can do is you can use either kind of the side portion of a wall, or you can actually use your other hand, right, to push against. So I'm pushing inwards, and I'm pushing outwards. So again, it's those four different movements: forwards, to the side, in and out. And then typically when you're doing these exercises, I'll generally have somebody hold for just a second or so on each one. And then just making sure you're not going into pain with this. So I'll typically tell patients just to alter the intensity of the push if there's any pain. So for example, if it's painful at 80% of your intensity, let's say, of pushing, well, maybe you bring that down to 60 or 50%. Again, staying clear of pain. Thanks for watching. If you have any specific questions or concerns, feel free to leave a comment below. Have a great day. Take care.